Good morning, everyone. We have the honor and the privilege to speak today with Colonel Yotam Shefer. Yotam served for over 20 years in the IDF at the field, leading missions of COGAT, and he will elaborate what is COGAT in a minute. And nowadays, he's the head of the foreign relation branch of COGAT, the headquarters of COGAT, running all the humanitarian support and the coordination between Israel and the Palestinian Authority in Judea and Samaria and Gaza and other places. So, Yotam, thank you so very much for spending this weekend with us. First of all, I want to ask you to elaborate a bit about COGAT. What is COGAT?
Hi, Nadav. Hi, everyone, and thank you for having me. COGAT stands for Coordinator of Government Activities in the Territories. COGAT is some kind of an evolvement of what began as a military governance back in '67. In the Six-Day War, Israel gained control over several areas, among them Gaza Strip, which was under military control of Egypt, and the West Bank that was under Jordanian control. This military governance turned into a civil administration after the peace agreement with Egypt, meaning that there's still military presence, but there was a separate organization or entity that dealt with the civil aspects with the local population. And then this civil administration turned into what COGAT is today, which is a coordinating and liaison unit. And that happened in the early 90s in the framework of the Oslo Accords and the establishment of the Palestinian Authority. What COGAT is, it's a military unit. As you see, I'm a military officer. It's a military unit that is part of the IDF, but also part of the Ministry of Defense. And what COGAT is in charge of is to deal with the civil, economic, and humanitarian aspects regarding the territories, both Judea and Samaria and in the Gaza Strip.
So when we're speaking about the humanitarian situation right now in Gaza, what described as humanitarian crisis in the media here, the US, are you the one that coordinates things with the Palestinian population and deal with all those efforts to support humanitarianly the Palestinian people? Is that your mission?
So yes, COGAT as the unit that's in charge of the civil and humanitarian aspects. Obviously, in the last almost 2 years, we've been focused almost completely on the humanitarian response to the Gaza Strip. And COGAT is the entity that is leading the humanitarian effort and fulfilling this mission according to the policy of the political echelon and the IDF to enable humanitarian aid to go in. And COGAT is the unit that coordinates and facilitates this with many actors and entities.
So I guess you're the right person to ask him about this kind of propaganda that Hamas ran for the last couple of weeks about starvation in Gaza, showing picture of kids that suffer from different kind of sickness, and showing them as an example of how kids looks like in Gaza Strip. Can you elaborate and speaks about the real humanitarian situation in Gaza Strip and what kind of effort your organization coordinate with the local population?
Yes, Nadav, if I may, before I touch that, I would like to describe a bit of what is a humanitarian effort, because it's important for me
Great.
that everyone that is here with us will get a good idea. A humanitarian effort is something very complex and challenging. There's a whole humanitarian ecosystem. When we speak about Gaza, there's obviously Israel and COGAT leading this effort, but there are many other actors that are part and involved in this humanitarian effort. There are the UN agencies, and we work with close to 20 different UN agencies or entities, UN clusters. There are also dozens of INGOs that are operating in Gaza and involved in the humanitarian response. There are state actors, both the regional actors, the main ones, of course, Jordan, Egypt, UAE, and also additional countries that contribute to the humanitarian effort, and of course, the United States. And in addition to that, there are also local Palestinian entities inside Gaza, professional ones that we also coordinate and we work with. For instance, the Palestinian Water Authority, and we might get to that very shortly about infrastructure. So how do we do those kinds of things? And of course, there's also Hamas in Gaza, and I think that Hamas is the entity that is challenging all the other ones in fulfilling the humanitarian effort. So this is a whole ecosystem of actors that are involved. And when you look at Gaza today, there are four different entry points where aid goes into Gaza and many corridors that aid comes from. There's an Egyptian corridor, Jordanian corridor. There's aid that is coming from within Israel, occasionally also from Judea and Samaria, and also imported through Ashdod port. And that is only the land corridors. There are also airdrops. There is a maritime corridor. Um, and just in the recent days, a shipment came from Cyprus with plenty of containers of aid that are intended to get to Gaza. So when we talk about a humanitarian ecosystem and humanitarian effort, how do you take now all these entities and manage a humanitarian response through so many entry points and corridors on a daily basis? And today, these days, the numbers are around 300, 350 trucks that enter and are collected every day into Gaza, most of it food, but also medical supplies, shelter equipment, and other humanitarian supplies. So to do such a thing in an active combat zone and in a place like Gaza, which is dense and where there's an enemy that we are fighting that does not comply to any humanitarian law or to any value that is embedded within the population and in the humanitarian installations, that is a very big challenge, and that is what we are dealing with here. Now, addressing your question about the claims of starvation and famine in Gaza, I can tell you the following. We in COGAT, we conduct assessments, humanitarian assessments on a weekly basis, and sometimes even more than that. And we monitor the situation in Gaza according to several aspects of the humanitarian situation. We follow the situation of food, how much food is going into Gaza and being collected and distributed. We know what goes in, we know the quantity, and we also know the caloric value of what is going into Gaza. We also look into the medical services and the medical system in general. What services are provided? What capabilities do they have? What medical installations are working and operating and what are not? We also look into wash issues, water, sanitation and hygiene, shelter, and some other things. And so this is something that we follow and we monitor very closely. And what I can tell you is that the claim of starvation, sometimes I must say that even on a personal level, I'm even offended. Now, why is that? Because we in COGAT were a unit of about 1,000 people that were fulfilling a mission, not only because it's the policy, but this is also our values. And 1,000 people that what we do all day and all night is to push these humanitarian efforts. And I can tell you that at any given time, if you would have came to Kerem Shalom crossing, which is the main crossing to the southern area of Gaza, at any given time in the last several months, if you would have gone to Kerem Shalom, you would have seen piles of pallets of aid waiting to be collected. Okay, aid that was already coordinated, approved, inspected, and gone into Gaza, lying on the platform waiting to be collected. Starvation is an intentional action to prevent food from reaching people. And the reality is exactly the opposite. We've been pushing aid to go in and to be collected. Now, about claims of famine in Gaza, we monitor the situation closely, as I said. We reject the claim that there is famine. There is no famine in Gaza. Um, we do acknowledge that there are difficulties. I cannot say that the situation in Gaza is good. It's not good, it's difficult, and the longer the war gets, the more difficult it becomes also for the people living there, for the civilians. And that is why we are increasing the humanitarian efforts. We know how much food is going in. There are areas that we acknowledge and we understand that the access to food is more challenging. For instance, if there's an area like Jibalia, okay, in northern Gaza, where there is active combat, there's a ground maneuver, people were instructed to evacuate for their own safety and security, and most of them did. But when there are people that decide for their reasons to stay in that area in an active combat zone when there is exchange of fire and IDF forces on the ground, then obviously the ability to enable access to food is more limited. But overall, that is the situation. That's how we see it, and just something that we should think of about. There were several publications and pictures that are terrible that you see children that are skin and bones. There are so many cases that at least that we were able to check because there was a name or a hospital where the child was treated. And then when we checked, and this happened numerous times, when we checked it, we understand that this is a child that is suffering from a genetic disease. Now, of course, the war has an impact. And obviously, if there wasn't a war, the child would have received a better treatment. But he's not like that because there's famine in Gaza. He's like that because he's suffering from a disease. Now, what I think that is interesting here, or what we have to think about, is that if there was famine in Gaza, why would they have to take a child that is suffering from a genetic disease and portray his pictures? Um, so that is our understanding, and we completely reject those claims.
We formally heard that the UN actually formally declared that there is starvation in Gaza. Based on what? And how do you explain the gap between what you just described of hundreds of trucks that go into Gaza and stories about starvation and about crisis in Gaza?
So I must say that we in COGAT, we work very closely with the UN and with the international community, both with UN agencies, but also with INGOs and many other actors. When we conduct a humanitarian assessment, we do that based on many sources and many mechanisms, both open sources. We also read all kinds of reports that are on the web and open sources. We also have intelligence, and we also speak with the UN and the UN clusters. I just must say the following. There are sometimes, or it's not only sometimes, it depends on what field it is, but in certain areas and aspects, the UN do not reflect the reality as it is on the ground. And I will demonstrate this to you. The UN, they have a dashboard. You can look it up and you can see that they published during August how many trucks have gone in the last 3 months. And you would see a number. It was about 3,000 trucks, a bit more than 3,000 trucks, when the truth is the number of trucks that went in the last 3 months at that given time was close to 9,000 trucks. So how do you have such a large gap? And the reason is because the UN counts only the UN trucks or other partners that are operating under the UN. The thing is that not only the UN is operating in Gaza and a part of the humanitarian effort. And not only the UN is bringing in aid, there are many other actors that are bringing aid into Gaza, including state entities and other INGOs and organizations. And therefore, now we know how much aid is going in. They cross through our crossings. So we count them, we coordinate them, and we know exactly what's going in. But it's not only a number of trucks, it's also the assessment on the ground. Nadav, when you're asking this, then I'm sure that we cannot ignore the IPC report that is out there. And there are some serious problems with this report. The sources the IPC, what does it rely on? We shared a lot of information, we as COGAT, about a week and a half before the publication of the report. The report ignores the information that was provided to the IPC, but it bases a lot of its conclusions on local sources in Gaza. And if you look into that, you would see that these are sources that are completely unreliable. Among them, the Ministry of Health in Gaza. I think we all know that the Ministry of Health in Gaza is a nice name for Hamas. It's completely controlled by Hamas. Its managers are Hamas ranked militants. So that's one source. Another source is UNRWA, and I think we all were devastated to see how UNRWA was involved in terror. Its employees were involved in terror, and how much Hamas infiltrated into that agency, and eventually it was taken out of the law in Israel. And other local NGOs in Gaza that are also not reliable and affiliated with Hamas or other terror organizations. Uh, I must say that this isn't the only time that the IPC published reports. We also saw in the past all kinds of forecasts about pandemics, about famine, that eventually did not occur. So I think that we should be very cautious when we see those things, and the reality is much different. And that is exactly what we in COGAT are doing. We're assessing and implementing the humanitarian effort.
So I'll translate what you just say to things that you cannot say because you keep things, very diplomatically, and I can get into those minefields very simply as a civilian. And I would say that the UN have political agenda. They know the truth, and although they know the truth, they publish other things that support their political agenda. And you, as one that monitored the reality in Gaza Strip, can definitely say that there is no humanitarian crisis. Yes, there is challenges, but there is no humanitarian crisis. And you, by the way, regardless those report, you coordinate with UN and work with them on a daily basis to support the people in Gaza Strip. And to bring me to another question, with whom do you speak when you are coordinate thing in Gaza? Is there is any local Palestinian that you speak to? You speak only to NGO, non-governmental organization, the US and other? With whom do you coordinate all those humanitarian efforts? Because at the end of the day, hospitals should get the support, the shelters that spread all over Gaza Strip. It's deep into the land, and you have to get to them with humanitarian effort like drugs and food and such. With whom do you coordinate in Gaza? Who's your boots on the ground?
So within the humanitarian ecosystem, there are many actors that are involved, and we speak with many of them. First of all, of course, with the humanitarian organizations, the international organizations, among them the UN agencies, such as the World Food Program, WFP, the executive director of the World Food Program, by the way, Miss Cindy McCain. She visited here in the area, and we have met her yesterday. We had a meeting with the chief of staff and with the head of COGAT, together with her to discuss the humanitarian activities and to see how we can continue to cooperate and increase the humanitarian response with WFP. There are also WHO, the World Health Organization, UNICEF, UNDP, UNOPS, UNFPA, and others that we work very closely with, many UN agencies. I can also mention that we have a joint coordination board. It's like an ops room that we man together, COGAT, with the UN agencies and also INGOs, that we sit around the table. It's manned every day, all day. And what we do there is all the tactical coordination of the aid that is being brought in and collected into Gaza. We also work directly with INGOs, with many of them. There are also quite a few American INGOs that we work with and that are active in Gaza. I think among them we should mention WCK, IMC, CRS, Multi Faith Alliance,
Is
GEM, and
Colonel,
others.
is it fair to say that those organizations have like a Palestinian employees that lives in Gaza for years, know the people, know the community, know the area, and are the one that at the end of the day connect to the people? Is it fair to say it?
Yes, it's fair to say these organizations employ people in Gaza. They have mechanisms of work, of collection, of distribution, and we coordinate these things with organizations. Most of them also have internationals on the ground that we also speak with, in addition to the local employees. So that is the international organizations piece. We also speak with Palestinian entities inside Gaza. So, for instance, when we talk about a humanitarian response, I elaborated about the trucks that are going in, but a humanitarian response is not only trucks, it's additional things. It's addressing essential infrastructure, for instance. So, how do you maintain telecommunication? Did it ever occur to you? How do the Palestinians in Gaza, how do they have cellular reception and internet? How do they post the tweets and the videos on TikTok? They have cellular services, and that is because we liaise and coordinate maintenance activity and repair with the local Palestinian telecommunication companies. The same goes with local water infrastructure and electricity and other companies or entities inside Gaza that we can work with and that they are legitimate. Um, we also work with state actors. So another example that I would like to give is addressing essential infrastructure. Water, of course, is vital. And today, I'm very glad to mention that we are promoting a UAE funded project in which they extended a water line from Egypt, from a desalination plant in Egypt, crossing the border into Gaza to the Moasi area. And this water line is supplying water to thousands of people in that area. And this is a project that was carried out in full coordination with the Emiratis, the Egyptians, and of course, local Palestinian teams on the ground that implemented. So there's humanitarian organizations, international ones. There are also state actors, and I gave some examples of that, and also local Palestinians, of course, that we speak and that we coordinate with.
So the government of Israel declared that they're going to extend the operation at the north part of Gaza, the area of Gaza City and the town surrounding it. And we all hear that the IDF start maneuvering into certain area around Gaza City, the area of Jabalia, Bet Hanun, Bet Laia, and such. Uh, as far as the assumption, was speaking about around 1 million people that lives in this area and kind of tenant cities. How we evacuate those people? Remember that you just mentioned that those area of combat or the area that it's very tough to support humanitarily the people that decide not to evacuate instead. How we push how we control the evacuation process out of Gaza and to where 1 million people goes in Gaza Strip.
So, yes, there are approximately 1 million people in the area of Gaza City and its surroundings, and the rest are located in central Gaza, mainly Deir el-Balach and the central camps, and the area of Khan Yunis, Moasi. In a case of evacuation, mass evacuation, the IDF, and this will not be the first time during this war, the IDF conducts evacuation of population for their safety and security when entering an area and doing a ground maneuver in order to separate or distance the population from the active combat and minimize the harm to the civilians and those that are not involved. We've done that several times during the war, and there are different means of doing this. There are text messages that are sent. There are papers that are airdropped to the population. There are announcements through media and through the IDF spokesperson and other means, including also direct phone calls to people in different neighborhoods that are required to evacuate. So there are various ways and means of doing so. I think the important thing here to mention is that it's not only the evacuation, but it's also, as you said in your question, where are they going to evacuate and what conditions are there in those places. So from Gaza City, the places to evacuate to are south from there, mainly to the areas in central and south Gaza. And what is important to mention is that, and these are efforts that are being conducted all the time to make sure that there is the proper infrastructure for the population and the proper humanitarian conditions. That means water, sanitation, and hygiene. That means medical system. And I can say that in addition to the hospitals, the public hospitals that are in Khan Yunis and Deir el-Balach, there are also more than 10 field hospitals that are operating in those areas. These are field hospitals that were established after October 7th in full coordination and support by COGAT, bringing in thousands of items for every field hospital, establishing the field hospital, enabling staff and equipment to go in, and eventually operating. So there are field hospitals, and we are working on expanding and adding those capabilities in terms of the medical services. I mentioned also the infrastructure. It's also important to enable additional shelter equipment to go in because people also need a place to stay. And of course, to enable consistent humanitarian aid to continue to flow through different routes into those areas and enable access to the aid for all the population.
Well, if there is any other message you want to deliver to our audience, that last week saw the news, all those drones throwing what looked like a Molotov cocktail as such to try to push the population out of Gaza, and it seems that the way it's described at the local media, that the IDF fight against the people of Gaza Strip. So regarding all those publications, is there any message you want to send to the people that are hearing you at the US?
Thank you. There are several messages that I would like to convey. The first one is this war was forced upon us. We did not choose this war. Prior to October 7th, we were in a completely different mindset. We were planning how we take Gaza years ahead. And we had plans of increasing even more the number of Gazans that can work in Israel. At the time, there were 18,500 Palestinians with working permits that entered Israel. We were planning to increase that to almost double that. We were already expanding the fishery sector and expanding the export of vegetables from Gaza. There were mega scale projects on the way. The big desalination plant that was funded by EU countries and UN and Office of Quartet. We were already working on a project of gas for Gaza that was supposed to bring natural gas from Israel's natural gas resources into Gaza, and with that address Gaza's energy needs. And even thoughts of joint industrial areas on the border. That was our state of mind. That is where we were. And we didn't choose this war. We wanted to go in different paths. But this war is a just one, and the war is against Hamas and the terror organizations. We do the best we can to distinguish between terror and the population. That is why the evacuations, that is why the significant humanitarian effort. Another thing that we do, and it's important to mention, is that we work very hard to enable evacuations out of Gaza. And we work with states and with medical entities. And just yesterday, there were hundreds of people that were evacuated out of Gaza to countries that were willing to take them in, some of them for medical treatment with their companions, and others that either have a foreign citizenship or a visa. And we evacuated them out of Gaza and then through Israel to a third country. And these are things that we do on a weekly basis. And we invest a lot of efforts to address these response for the population. Another thing that's important for me to mention is that the humanitarian effort in Gaza is completely different than any other thing in the world. I think that sometimes people tend to think that Gaza is like Haiti after a hurricane or like Turkey after an earthquake. And it's not, because in these two cases, when there's a natural disaster, as horrible as it can be, once it's over, you have no limitations and you have no challenges of giving a humanitarian response besides nature and maybe the bureaucracy of the hosting country, which is usually very supportive. In this case, we are managing a humanitarian response that I think is very challenging and increasing and developing more and more as time goes by, and doing that in a combat zone, as I mentioned, in a combat zone that we're fighting an enemy that is embedded in the civil humanitarian environment. They are carrying out activities from hospitals, from shelters, from schools, from mosques, and creating this situation or carrying out this humanitarian effort, dozens of convoys, look, 300, 350 trucks going in and crossing Gaza every day, and coordinating that when we have several divisions and thousands of soldiers of IDF troops on the ground, enabling that all to happen during active combat. It's a significant challenge. And yet, I'm very proud of what we're doing. And eventually, the humanitarian effort is in interest of Israel. It's part of our effort. And I think we're able to make this coexist with the military operational efforts.
Thank you, Colonel Shefer, for your service and for spending this morning with us and sharing the true story about what's going on in Gaza Strip. And you have all the reason to be proud. We definitely, the friends of the Israeli Defense Forces, proud of you. I want to thank you for sharing the real situation and how kind of great effort the IDF and through COGAT sending to Gaza Strip and verify the gap between the stories that we're hearing every morning and every evening at the news here at the US and what really happened on the ground. Thank you for that, and keep safe. Continue with this amazing journey you do. Thank you for your service and send our love to all your soldiers. Thank you.
Thank you, Nadav. Thank you for having me. And I want to thank all the supporters and all the members of FIDF. We really appreciate it and cherish your support and your help. Thank you very much.
Thank you.